When you think about communication in health and social care, it's easy to picture a quick chat between a care worker and a patient. But in reality, the ways we share information go far beyond that. In this field, the message often has to travel between professionals, service users, families, and organizations. And for that, both oral and written communication play important roles. Each method has its own purpose, its own strengths, and its own place in delivering care that is safe, respectful, and person-centered.
Let's start with oral communication, where messages are spoken aloud. In oral communication, one of the most common and most effective forms is face-to-face conversation. It's a conversation when two or more people sit together and speak directly. It's not just about the words being spoken, it's also about the tone, facial expressions, body language, and eye contact. This combination allows people to understand each other better, ask questions, give immediate feedback, and build trust. In a care setting, this might be a discussion between a nurse and a patient about symptoms, or between a support worker and a family member during a visit. Another form of oral communication used in health and social care is through group discussions or meetings. These usually happen when care professionals come together to discuss someone's progress, update care plans, or make joint decisions. Group conversations allow multiple viewpoints to be heard and help everyone stay on the same page.
Then there are formal presentations, often used to explain more complex cases or share findings with a team. Presentations give professionals the chance to deliver structured information clearly and confidently, especially when supported by visuals, charts, or case summaries. Of course, not every conversation can happen in person. Sometimes professionals turn to telephone conversations, a form of oral communication that works at a distance. While it lacks the physical presence and visual cues of face-to-face conversations, a phone call still allows quick updates and direct communication between colleagues, carers, or even service users and families. In these moments, tone of voice and active listening become even more important.
Now let's turn to written communication, which is equally essential in health and social care. It creates a lasting record, something you can come back to, check, and rely on. And one of the most important examples of this is report writing. Reports are written to explain a service user's condition, document incidents, or record treatment outcomes. A well-written report can guide future care, inform doctors, and ensure nothing is missed. It often includes details like symptoms, test results, diagnoses, medication, and next steps.
Alongside reports, we have medical records, documents that hold a complete history of someone's health, changes in their condition, and treatment plans. These records help professionals make decisions based on past care and keep everyone updated on the person's progress. They are also useful for spotting patterns or responding to emergencies.
Another key document is the patient care plan. This is written with the person's needs, preferences, and choices in mind. It outlines what kind of support they require, how often, and in what way. Care plans help to make sure that the support provided is not only safe, but also tailored to what the individual wants.
And then there's email and letter writing, used to share updates, request information, or communicate with families and other carers. For example, a care home might send an email to inform a family about a change in their loved one's medication or a recent checkup. These written messages are quick, clear, and easy to refer back to later.
So, whether spoken aloud or written down, communication in health and social care is always about more than just passing on facts. It's about making sure the message is understood. It's about clarity, respect, and building trust. And most importantly, it's about choosing the right method for the right person at the right time.